Our mission. Why do you enjoy these classes, doing these classes?
Well, because it educates the therapists that take your class to the power of the technique and the possibilities of the technique so that they can utilize it to help people. Uh, my mission is to help people, save people from unnecessary and excessive medical treatments, surgical procedures, other treatments and diagnostic procedures and pharmaceuticals that aren't necessary. One day, and it wasn't but a year or two ago, I had a aha, and I said, I did about thousands of unnecessary foot surgeries from 1971 until I discovered Bowen in 1995 because my surgical foot surgeries would 8 to 10 a week in and week out. That dropped to about 5 or 6, and I said, the three or four or five patients a week that didn't need that foot surgery probably from 1971 till 1995, 6, 7. And I said, I did a whole lot of foot surgery that I didn't need to do. How many knees and shoulders and carpal tunnels and all are being done and all those. Then I thought about the prescriptions that my patients flushed down the toilet they wouldn't need anymore, and the gastroendoscope procedures they wouldn't need anymore. And not that I treat those conditions, but I realize that people go through, like the guy with fibromyalgia, a medical journey with misadventures and mishaps. And, it's a little bit of money or system. That's a whole other issue. But the more of us that know how to do the Bowen therapy, the more people we can help save them from those medical misadventures and mishaps. And really, they're called morbidity and mortality. People die from drugs, people die from surgical complications, people die from MRSA, they die from anesthesia complications, they die from pharmaceuticals, they die from all kinds of treatments that are medically oriented, and they don't have to. They go on these journeys where they don't die, but their life is miserable, but they don't have to. And we can help, and I help worldwide because I'm on Facebook and I post and I write and I post cases and history and information for therapists around the world so that they can transfer those informations into their practices, just like you can transfer this information this weekend into your practice to help people locally, and eventually maybe you will span out to be globally or more away from your community, but in society to make a difference in people's lives. Does that make sense? We don't have to be miserable. And there's a whole host of different reasons why people get sick or have signs, symptoms, and disabilities. I call them PAPA issues, premature accelerated physiological aging. And millions of people have cancer and diabetes and arthritis and acid reflux and all kind of fibromyalgia and all kinds of problems because of what I call the ions of disease. And tension ends in ion. Um, Acidification ends in ION. Stagnation ends in ION. And Bowen therapy affects all of those things: tension and stagnation and lack of circulation and innervation and hypertension, all kinds of issues. So that the more you know, and the more you do, and the more you educate your patients and your fellow therapists, the better we can do for mankind.
Yeah, absolutely. Thank you.